This week, Harris County is hosting its Racial and Ethnic Disparities Conference.
People will hear or get to hear from professionals who will explore the disparities from healthcare to the justice system. Natosha Willis with the Office of County Administration is joining us right now. And so this is a topic that I feel like in recent years, this has been something that's been at the top of mind for people. But why is it so important to keep discussing this?
Yeah, so this is actually the second year of the conference, and the overall aim of the annual conference is to confront disparities in the justice system. And so our office wanted to host this two-day event as a way, which we're calling Mindful Justice, exploring health disparities and inequities in the justice system. But we wanted to host this two-day event as a way to examine and address racial and ethnic disparities in healthcare practices and policies. So what research shows us is that justice impacted individuals often face barriers, whether that's due to their record or the stigma of incarceration, that interfere with their access to adequate health care and treatment. And so we wanted to focus on these disparities as a way to address and hopefully kind of lead to fostering a more equitable justice system, as well as improve health outcomes for all individuals involved.
Like find a way to stop or to make sure that people in the justice system are able to get the health care that they need.
Exactly.
Do we mean something as basic as someone is arrested and is in jail, and so obviously when they're there, they may not be making their medical appointments? I mean, kind of give us some examples.
So it just really depends on the actual institution. So you have some institutions that are always like clockwork, having individuals either take their medicine or go to their appointments. But think about how some of those individuals, so once you're incarcerated and you've been charged, you often lose your health insurance.
Oh.
And so once you're released, you have to navigate that space of regaining, whether that's through your job or whether that's through a government type of health insurance. And so, yes, it's as simple as that. Sometimes individuals don't get the proper health care, especially if those who are working with those individuals who are incarcerated don't know their actual medical needs. So it can truly vary. And then again, think of individuals once they're released, they are so used to those working in the system, again, like clockwork, helping them to take their medicine, reminding them of appointments. They don't really have that autonomy once they are released. And so there's often a gap in the health care that they receive, especially if they have to now regain that insurance and try to get that back.
So at this conference, I mean, I know you mentioned, it depends on the institution. Are we going to hear from those institutions at the conference, or who's speaking at the conference that people might learn from?
Yes, definitely. So we're going to have Harris Health, who is actually the provider for all of the medical treatment and health care at our Harris County our Harris County Jail, as well as our keynote speaker, she's actually the executive director for the Ohio Commission on Minority Health. And so she's truly been pioneering an innovative space there. And then we will also hear from some of the doctors, those who are serving in the community. So not just the actual medical professionals, but the advocates who are working with those who are re-entering and trying to help them navigate that space, again, whether it's getting vital documents or any other pieces of information or critical pieces that they need in order to, again, gain that health care back or that health insurance.
Interesting. I know you guys are already full. I mean, you already have all the people that you need for the conference there. I'm just curious, like, what type of professionals? Are these mostly attorneys? Are they mostly social workers? I mean, like, who is your primary audience for the conference?
So there are going to be a number of people that are attending, from your practitioners. We will have some attorneys. We actually have some individuals from the DA's office that will be doing a panel. But we also just have, again, the community advocates, those who are really interested. Some individuals who have family members who have been incarcerated and been impacted by this. So we're going to have a number of different attendees. We have a little over 200 attendees that will be at the conference, as well as about 50 different speakers and presenters who will be there and working with them.
I know we've only begun to scratch the surface on what you guys are going to be able to cover, and I don't even know if we said the name of the conference, so please tell people where they can learn more information.
Yes, definitely. So again, the name of the conference is Mindful Justice, Exploring Health Disparities and Inequities in the Justice System, and individuals can go to our website, which is mindfuljustice.carrd.co.
All right, and we will clip this and put a link to that website as well.
Definitely.
Thank you so much for coming in today.
Thank you so much for having me.
Yeah,
Thanks.
Natosha Willis, we appreciate you coming into studio. We're going to take a quick break and we'll be right back.
Thank you.